I'm Shahed. I'm the co-founder and president at Noora Health, and I have a background in public health and medicine and looking to use human-centered design to improve the healthcare of populations. I can tell you from the design perspective, this was something that really came through needs finding in our process of trying to understand the user that we were trying to serve. In the beginning, this was basically we were looking at the Indian healthcare landscape and really getting to know by talking to patients, family members, doctors, nurses, administrators, really what were some of the pain points that we could come in and do a project on. Actually, it was a project for a graduate school class that I was taking. And so we used this design thinking methodology to really understand and empathize with the user that we were trying to serve. And the thing that struck us was the disengagement of the family member from the process of healthcare delivery. And especially in a chaotic, busy, and low-resource environment, such as the Indian healthcare system, we saw that the family member was a valuable asset and the one who cared for the patient the most, the one that knew the patient the best and would be spending the most amount of time with the patient in the long term. So why not actually engage them in the process of caring for the patient so that there's better experience, but then also better outcomes once they go home. So that's kind of initially how it started through that design thinking process. Then over the past several years, we've been kind of adapting the model for impact and for scalability. And it's actually a little bit more than just a technology. It's really a program and a service that we offer to strengthen health systems. And so, there's training component, there's a content development component, and also a small technology component as well that allows us to reach out to patients and families once they go home. Our vision is certainly global. India is a new state in India is like a new country every single time, but we do have our sights beyond that. Even within the year, we're hoping to expand just to the neighboring country of Bangladesh, and we also have been, because a lot of us are actually, initially we were from the US and have some interest in the US healthcare system as well. So thinking about how can we adapt our program for the context here. So that's again in really the early stages, but certainly in our vision. Being a social entrepreneur and being kind of an impact focused organization is kind of lonely. Not too many people really understand the space and what we're trying to do, and so this kind of really allows for for us to have a network of professionals and peers, colleagues that are doing similar things. A lot of networks that we're part of, even if they're focused on social entrepreneurs, they may not necessarily be healthcare focused. So I think this is the only one that has that kind of domain expertise for us, and we know, and because health is such a kind of a tricky domain to work in, there's a lot of unique challenges. So it's really nice to be a part of a group that has that's looking at some of those same challenges. And I think one of the things that we really learn from is seeing groups from all over the world. We're working in India, has its own set of challenges, but just seeing how that translates to other places, it gives us an opportunity to understand, what do we need to do in order to really grow and scale internationally. I think the biggest connection that and biggest achievement really comes from a person. And this was a person who used to be a Duke University grad student. And we met him through the network, actually at one of these conferences that we're sitting as a part of today. And he was really interested in coming in and just working on a project with us within kind of our research team. But we found so much value in him, and he really changed the whole structure and infrastructure that we had in our monitoring and evaluation team, and really changed how we thought about monitoring and evaluation. So this one person, while he was supposed to spend a few months, ended up spending 3 years as a big part of our team. And I think that has been game-changing for us, really. And our research is a big part of how we're able to prove and scale our impact. So we're really, really thankful for that connection. There's certainly been others as well, but that's what stands out most to me. Yeah, this theme of connections, it wasn't just this person that was brought in front of us. We also have had a couple partnerships that have come out of this. And one of the things that we're concentrating on as we scale is how does our program and our overall methodology actually apply to the U.S. healthcare system. And we've had several conversations through the network and through kind of connections we've made at these conferences about how that could actually come out. And so now we're working on a planning grant basically to do that. So it's been lovely to be part of this because we've been able to kind of leverage this for bringing our work to a completely different context.